Hello, I look forward to taking you on a quick tour of Fax2Mail for Healthcare powered by No2 and the HIPAA-compliant method to exchange faxes and intake them into your organization. Fax2Mail is cloud-based and puts faxing at the desktop, allowing your staff to fax quickly and securely, eliminating the need for fax servers, fax machines, and related infrastructure, reducing fax costs while improving productivity. Your staff will appreciate the intelligent file names created by Fax2Mail for Healthcare versus what fax machines, multifunction devices, and fax servers create. It will be easy to match the document to the chart, and you can easily find documents in the workflow prior to upload to the chart. Fax2Mail for Healthcare improves the efficiency of downloading faxes into the individual's chart in your document management system, practice management system, or EMR. The intake process supports many use cases, and we will review the easy intake and release process in our demonstration today. I'm logged into the portal and looking at the incoming messages and documents in intake, similar to an email inbox. Intake lists all of the documents that are sent to or assigned to you by the intake rules, and the documents are encrypted for compliance with HIPAA. Notice the PDF symbol to indicate the type of document, in this case a fax that was received from the listed fax number. Whereas here is a records request you made to another organization, and here is their response. Here's the records request being made of your organization. And here is a direct message with the transition of care document from one of your referral sources. When we select one of the items in the intake, like this fax, you can review the contents and discover a lab result for Mary Smith. So you quickly label the document with a few pieces of information, including the medical record number, first, middle, and last name, date of birth, and the document type. When you download the document, it is labeled with this information for automated or manual upload to the correct individual's chart. In some cases, you will review the fax and discover there is more than one document for one or more individuals. Here we find a second lab result for a different individual, Paul Charm. So you open the document and triage it to separate the pages and documents. Today, this is a very time-consuming process for you and your staff. The triage feature simplifies this workflow. You can start by selecting the cover page and deleting the unnecessary page or pages. Next, you create a new message and attach Mary Smith's lab result to that new message, and designate the triage rule you would like to use. You can send it to your own intake, called My Intake, or send it to a different rule and the associated users. And then you enter Mary's name. Then you create a second new message, this for Paul Charm's lab result, and you can select your own preferred triage rule and then enter the individual's name, Paul Charm. And then you submit the two newly created messages to No2 to be processed based upon the selected rules. The indexing is completed and downloaded for the chart. The routing rules allow you to define the attributes that control the routing based upon the sending or receiving fax number at the time of the initial receipt, or the triage rules when processing a fax. In the case shown on screen, all faxes from Mercy Hospital's designated fax number will be sent to two users, and they will receive the fax in their intake to be processed on a first-come, first-served basis. You can set up the rules to fit your organization's needs and change them as your needs change. As you will recall, when I triaged the fax with results for both Mary Smith and Paul Charm, I was able to send the newly created messages to myself or route them to a triage rule for other users. For instance, the users that are responsible for labs. Each user can decide if they want to receive email notifications for a variety of alerts, including new messages that are routed to them based upon the intake and triage rules. There are multiple methods to release records or send faxes with PHI. The most common is the release functionality. Notice the status of the previous releases as shown in this dashboard view. After selecting Release, you add the desired documents to the fax and the information for the fax cover page. This information is kept as part of the audit, and the cover page is automatically created. Now the fax is ready to send with all the benefits of cloud faxing via Fax2Mail for Healthcare. Fax2Mail for Healthcare optimizes document exchange with your current faxing workflows and combines all forms of exchange in a single solution, giving you the tools you need to transition from today to the future of care coordination without disruption. To learn more about Fax2Mail for Healthcare powered by No2, contact OpenText today.